We're working with two companies right now. The first is a company called Soterra Wireless, which some of you may have seen. It's a San Diego-based company that has a small device that fits on your wrist, and it measures on a continuous basis your vital signs. And then these vital signs are wirelessly transmitted to the nursing station and then eventually into the electronic medical record. So rather than the nurse coming to your room every 3 or 4 hours and taking your vital signs, now they're done on a continuous 24-hour basis, which I believe that looking back 5 or 10 years from now, we're going to say, wow, why would you ever have only done vital signs every 3 or 4 hours when you could do them constantly?
Right.
So that'll be a big improvement. The second company is a company called Savvy Sherpa that Dr. Mark Ott and others have been working with now for 1.5 years. It's based around the fundamental concept that mobility is good for you. So, you know, sitting on the couch, being a couch potato, watching TV, drinking beer, you know, it's not the way that's going to keep you healthy.
It's a shame, but true.
Yes, so, but walking is good for you. So Dr. Ott and the experts from Savvy Sherpa have been working on an accelerometer, which is a Fitbit-like device, except it's engineered to a much higher level. And this device now actually marks who you are, so it knows who you are. The importance of that is that you can't cheat. Not that you would, but you can't. So you can't take it home, strap it to your dog, give it to your kid, and he runs around, you know, and the doctor thinks you're walking. And then what Dr. Ott and others are working on now is saying how much walking is the right amount after surgery. So day one post-surgery, how much do you walk? There's really 3 things that matter. How much you walk, how many steps, how often you walk, how many times in a 24-hour period, and what's the intensity at which you walk. What we've been doing is saying day 2, day 3, day 4, what's the right amount of mobility, working this right into a clinical protocol, and then when you reach the right number of steps, number of times, intensity, assuming everything else is okay, you can go home. So the early indicators is this has both reduced length of stay and dramatically reduced readmission. So pretty exciting technology.
Yeah.
And that can be monitored and built right into what I think are going to be some pretty interesting wellness programs that for people who will improve their health by walking and moving, they can get a break on their deductible, and it will ultimately result in better health and lower healthcare costs.